Welcome back to the Dr. Jeffrey Tauth Heart Talk Show, and today's show is called Dr. Jeffrey Tauth Grief Rewrites Your Heart's DNA. And trust me, it's juicier than your cousin's peach cobbler. Did you know that losing someone you love can literally change the structure of your heart muscle within hours? I'm talking about your actual physical heart, not just that metaphorical broken heart feeling. Yep, entirely true, I can't make this stuff up. Today we're diving deep into how grief physically rewrites your heart and what you can do to protect yourself. Let me paint you a picture that'll blow your mind. When you experience intense grief, I'm talking about the kind that knocks you sideways like a freight train. Your body unleashes a tsunami of stress hormones. These aren't your garden variety butterflies before a presentation. We're talking about adrenaline and cortisol levels that would make a NASCAR driver jealous. Here's where it gets wild. These hormones flood your heart so intensely that they actually cause your left ventricle to change shape. Picture this. Your heart's main pumping chamber suddenly balloons out like someone's blowing up a water balloon inside your chest. It's called Takotsubo cardiomyopathy, but I like to call it broken heart syndrome because that's exactly what it is. Your heart literally bears the physical weight of emotional loss. And if that doesn't make you respect the mind-body connection, I don't know what will. Now you might be thinking, Doc, that sounds like a heart attack. And you're absolutely right, it mimics one perfectly. Same chest pain, same shortness of breath, same scary EKG readings. But here's the kicker. When we look at your arteries, they're cleaner than your grandmother's kitchen counter. No blockages, no damage to the blood vessels. It's pure emotional overload reshaping your heart muscle. So why does this happen? Think of your heart as the world's most sophisticated drum, keeping perfect rhythm for decades. When grief hits, it's like someone cranked up the volume on every stress hormone in your body and started playing heavy metal instead of your usual jazz. Your fight or flight response goes absolutely bonkers, and your poor heart is sitting there trying to keep up with the chaos. Here's something that'll surprise you. Women over 50 are the most susceptible to this. It's like grief and menopause decided to throw a party nobody wanted to attend. The hormonal changes that come with this stage of life make the heart more vulnerable to emotional stress. Ladies, if you're in this group and going through loss, maybe I should see you in the clinic. We need to talk. Let me tell you about Maria, a 58-year-old high school teacher who taught chemistry for 30 years. Hours after her husband's funeral, she's in my emergency room clutching her chest like she's having the big one. Her EKG looked like a textbook heart attack, but when we checked her arteries, they were pristine. Her left ventricle had literally changed shape from the weight of her grief. But here's the beautiful part of this story. Maria's heart wasn't broken forever. With proper counseling, stress management, and time to process her loss, her heart returned to its normal shape and function within 6 weeks. 6 weeks. The human body's ability to heal never stops amazing me. That's the good news about broken heart syndrome. It's completely reversible. Unlike a traditional heart attack that leaves permanent scars, grief-induced heart changes can heal completely with the right care. Most people recover full heart function within 2 months, which is faster than it takes to break in a good pair of boots. But prevention is always better than treatment. If you're going through grief, and let's face it, we all will at some point, you've got to protect that ticker. Stress management isn't just feel-good fluff, it's legitimate heart medicine. Support groups aren't just for processing emotions, they're keeping your left ventricle from turning into a water balloon. Here's your action plan, and it's simpler than you think. If you're grieving, don't tough it out alone. Monitor your heart health and never ignore chest pain. Even if you think it's just emotions, get it checked out. And here's something you can start today. Practice deep breathing for just 5 minutes daily. I'm talking about real intentional breathing that tells those stress hormones to calm down and gives your heart a fighting chance. Your heart doesn't just pump blood, it carries your emotions, your stress, and yes, even your grief. Respect that connection, and your heart will serve you well for decades to come. This has been the Dr. Jeffrey Tauth Heart Talk Show. Until next time, stay healthy, and remember, if you're looking for answers, check out drjeffreytauth.us.com later, y'all.